Yes.
Then they can go back to the exact same side. It doesn't matter.
Right.
You know, but they're going to want to reinspect.
Yes.
If there's damage, they're not going to do it.
Exactly.
Okay.
So the code to reset the thing is triangle, square, circle. That's to reset the recorder completely. Again, what Judy's saying is, again, that's another way that we can do it. But if we're in a time crunch and we want to drop another Bravo and we've had issues, we can just grab another recorder and grab another disposable and drop it there. That's going to be significantly easier. Hey, which recorder is it? I don't know. And then we start to lose, you know, comfortability with the whole procedure and which recorder it was, and it just gets confusing. So from a patient education aspect, what's really nice is we actually have a new video that came out that we can show the patient. It does a great job of explaining the procedure. It makes them significantly more comfortable with what's going on. But these are some of the very, very key things we have to make sure that we tell the patients. The purpose of the study is a pH to monitor the frequency and duration of gastric reflux and how it's related to the symptoms during the normal day. We want them to make sure that they're going about their day normally, right? We want to make sure that we're getting the same symptoms that they would get on a daily basis anyway. You must eat, drink, work, and exercise as you normally would. Please drink limited amounts between meals and do not sip over long periods of time. What we want to do, that's just going to make sure that we're not washing and basically clearing. If you just drink a ton of water, it's going to clear all that pH away from the disposable or from the capsule. It's not going to get an accurate reading if you're constantly it's not getting an accurate reading of what the pH actually is in your esophagus. Do not chew gum or hard candy during the study. You can take a bath, but of course don't take the recorder into the bathtub. I typically like to say, do you take your cell phone in the bathtub with you? No, don't do it with this either. Do not take any anti-acid or any anti-reflux drugs during the study unless it's indicated by the physician. We want to make sure, and it's tough for a lot of patients because they have such severe reflux, they're having such severe symptoms, that it's tough to be off your pump inhibitors or anti-reflux or PPIs. It's tough for them to go through that, but we want to make sure that we're getting a good indication of, they're on triple dose of PPIs. What's happening off those PPIs? What's going to happen if they stop doing that completely? So we want to make sure that they're off unless it's indicated by the physician that they want to do it on their PPIs. During the study, you'll be asked to record your meals when you lay down, when you experience symptoms, using a paper diary and recorder buttons. You typically want to make sure that they're not eating big chunks of meat and stuff too. You can cut them into smaller pieces, but I typically like to say for that 96 hours, please try to stay away from eating steak. What that does is, it helps with not having the ability, if they're eating huge chunks of steak, it does have the ability to knock it off. We don't want to do that within that testing period. Here is some guidelines on when to stop their anti-reflux stuff. So the pump inhibitors 7 to 14 days before the study, H2 blockers 3 days, antacids 1 day. This is going to be the patient diary. You want to print this off for every single patient. We have it in English and in Spanish. It does a really, really great job. Again, patients are in a hospital right now. They're pretty stressed out, so we can talk with them through the procedure, but what's great is this goes home with them. It walks them through absolutely everything, and it does a great job, I wonder if it'll see, of explaining each one of the buttons here and how to actually fill out every single one of the symptoms in patient diaries. So there really isn't any questions at the end of it if they actually read it. Typically, you like to put a nice point of contact on here if they have any questions. Recorder time, again, that's super important before we even drop a Bravo capsule, that is set to the appropriate time and date. If it is not, when we go to upload, it will be incorrect, and it's very hard to interpret the data if it's incorrectly put on there at the time and date. This is going to be the pH. You're going to want to see 1 on here. That means we've only dropped 1 Bravo capsule. Again, meal, chest pain, regurgitation, and heartburn, and then laying down. Meal, start, stop, laying down, start, stop. Every single one of these, it's just a 1 indicating. You're just clicking it 1 time, hey, I had chest pain, hey, I regurgitated, hey, I have heartburn. This is also really important. The Bravo recorder, just like your cell phone, will go into like a sleep mode. Basically what you want to do is make sure that you're waking it up by clicking a button and then clicking the specific symptom button that you're having, or meal, or laying down. If you click it without it basically being woken up, just like your cell phone, it's not going to record it. So the screen will be dark. It is working. If that blue light is on and blinking, sometimes they're like, oh my god, it turned off, I don't know what to do, blah, blah, blah. And then actually go to turn it back on. So they'll click the button on the side and they'll turn off the recorder. They'll ruin the study. So basically just say, hey, it's exactly like your cell phone. We just want to make sure that it's awake when we do any sort of input into the symptoms that you're having, or eating or laying down. So here's the recorder settings. You can go in there, you click the buttons to go up and down. You can go and change the time and date. You can change the study duration. And there's a couple other settings that we don't want to mess with, so I'm not even going to talk about them, because I typically will talk and then they'll get changed in some way. So when we go in there, there's going to be a setting for how many capsules are we dropping. We're going to just drop 1 in most cases. Study duration sounds like we typically do 96. You can do 24, 48, or 96. And then we want to make sure that that show pH value is going to be on that. Brian and I, when we're in the procedure, we'll make sure all the settings are correct before we get moving, but it's also, we'll show you how to do it. It's a lot easier to show you on the recorder itself on how to change those settings.
So you guys like to show pH value? I've always turned it off because you have those patients that are like, my pH is 6, my pH is 7, you know, whatever it is. That's the I wish there was a way to show the pH while you're putting it in, and then it goes away.
And it goes away.
Because patients panic when it's showing, I'm telling you.
Yeah, they do.
You know, when they're they're like, I'm going to try to make this acid. I'm going to drink a bunch of apple juice or whatever.
Right, exactly.
It's like a game to them then.
Typically, it's up to, I guess it's up to the physician, but the reason why we do have it on is when we drop it to make sure that we're getting some type of pH reading. If you did want to go in there and change that setting after, you can do that. Typically, from what I've seen from the other accounts I've worked with, they all have
Just leave it on.
the pH.
Okay.
Yeah.
Okay.
I'd be interested to see those specific patients that are super worried about that. A lot of people don't really know one way or the other. But yes, they can make it a game. I want to make it super acidic in my esophagus, so I get great readings, or which are bad readings. So it goes back. Yeah.
Okay, but you're saying the standard is leave it shut.
Is leave it on.
Okay.
Yep, exactly. Again, here it goes into some of the preferences on the recorder itself. Again, I wouldn't go in and change any of these. You want to make sure that the LED blinks. Again, Brian and I will make sure that each recorder is set appropriately. But visually, battery full, date, and to make sure that it is connected to the appropriate Bravo capsule. Those are the 3 takeaways today. And again, we'll be in the Bravo procedures with you guys for the first few to make sure you guys are comfortable. We're both always available if you guys have questions. Call, text, FaceTime, email, IM, whatever you guys need. Are there any questions?
Yeah, I have one for the team.
Yeah.
So as I'm watching this presentation, especially the education part, I have a nursing concern that I want to bring up with all you guys. So to me, this looks like a lot of patient education, like a whole lot on how to handle the recorder and how to use it and work it, a lot of patient education. So at what point, we don't have our patients post-procedure, they have our patients out there. So are we planning on doing any kind of like education ahead of time when we're gonna have a Bravo patient? Or like at what point are we gonna have the time to deliver this education? Because if we're doing the procedures and we send a patient out to recovery,
Yeah, from a
Who's gonna
physician
do?
perspective, I'm not gonna have time, we're talking
Yeah,
10
this is a
procedures.
lot of patient education,
like,
I mean, a whole
education
lot.
hours.
It is.
Even,
And I
even
think-
as simple as turning off the recorder, I mean,
Right.
that, there's probably 20 minutes of patient education.
Exactly.
At least.
Yeah.
20 to 30 minutes of patient education,
And,
so.
and the only way the education really works is if you have 20 minutes or so patient pre-procedure
Yep.
and 20 or 30
Because
minutes with the
afterwards,
patient
they're not
at
even gonna
post-procedure
remember
with,
half that
with their
stuff.
loved one.
Right.
You
The
know,
loved
you
one
need,
is
you need
important.
to, whoever's giving them a ride home, their significant other or whatever.
So
needs to
my
be aware of
concern is,
it.
where do we implement this patient education?
In our workflow, that's the problem.
Did
Right.
you say that